The National Youth Service starts with a 3-week orientation in camps located across all 36 Nigerian states and the FCT. Following this, corps members are deployed to both public and private sector organizations to work for another 11 months. Now, when COVID-19 broke out, the exercise could not take place due to restrictions on movement, fear of the health risks to corps members. But since the first year of the pandemic, NYSC camps have reopened safely, and with the next batch going in later this month. Joining us to talk more about the safety in the camps is the One Health Division at the NCDC. She's Dr. Oyelaju Nkurumade. She also leads the NYSC NCDC Safe Camp Reopening Project. She joins us virtually from Abuja. Thank you for joining us on the program.
Thank you for having me.
Doctor, how daunting was the task to reopen the NYSC camps? And this is at the peak of the pandemic.
For us at NCDC, I would say that one of our vision actually is to ensure that we respond to outbreak of diseases across the state, irrespective of where is occurring. And our vision is to ensure that we protect the health of all Nigerians. And we should also remember that before we start reopening, before we even had a lockdown, we started having cases of COVID-19 in Nigeria, and we've activated our response activities across the country to respond fully and actively to COVID-19 outbreak in Nigeria as far back as last year, February. And we've deployed all our rapid response team, deployed all our resources. We've activated all the necessary laboratory network to ensure that we rapidly detect the cases, and all the emergency operation centers across the state are fully mobilized to respond to this. And following lockdown, we started working with different sectors to ensure reopening of different businesses and sectors. We worked with aviation to reopen our aviation system across the country, and we developed guidelines for that, the same for schools, universities. So with NYSC, it wasn't a daunting task. It was like part of our usual process of working with different agencies to ensure that we put up measures in place to ensure the safe reopening of their orientation camp. And this was actually easy for us as well, with the full commitment of NYSC top management. We were able to align our visions as well as their protocols with their own strategies to ensure that the corps members are safe while in camp, and also to continue to build the trust of the public as much as the parents of these corps members in the NYSC process.
Camps. Now, with another batch expecting postings, batch C, I believe, stream 1, prospective NYSC, where does taking responsibility start from? And this is if there is a positive case, for example, in camp.
With the expectation of batch C going to camp from next week now, we'll continue to leverage on the same protocol and the same guidelines that we've instituted. And we keep working with the existing COVID-19 national response structure that have been put in place. This is to ensure that we leverage as much as possible on the surveillance structure at the state level where these camps are hosted, to ensure that we use this avenue to establish the surveillance system across camps, which involves compulsory COVID-19 screening tests for all prospective corps members on arrival, and before registration, as well as all the camp officials. Only those that are negative are allowed in camp. This is to ensure that we reduce transmission as much as possible in camp. We've also worked with the NYSC management to reduce the number of corps members that have been mobilized per time as against what we used to have in the past. This is to ensure that it's easy for observance of physical distancing in camp to as much as possible reduce transmission. We all know that this virus take advantage of people gathering to thrive. So it to be easy for us to ensure that it's easy to practice physical distancing of 2 meters. We've drastically reduced the number of intake, and we batch their resumption daily to ensure that they don't cluster together at the entrance while conducting the COVID-19 test. And we have surveillance staff across the state surveillance staff across all the camps working with the NYSC officials to ensure that this screening is done, as well as if anyone is positive, they will activate the surveillance system for the COVID-19 structure at the state level. Such an individual is immediately taken into state isolation facilities where it will be monitored and managed according to COVID-19 protocol, national COVID-19 protocol. And also the same activation of the surveillance structure ensure that you conduct contact tracing of all the people that are in contact with such an individual. At the same time, corps members are mandated to come to camps with their face mask and hand sanitizer. Face masks are compulsory in camp for every activities, be it during parade, during lecture, and during lecture to avoid clustering together. We also try as much as possible to make use of the e-learning tools. So some of these measures are the measures that have been put in place. And there are also strategic temperature screening center put within certain strategic locations in camp to ensure that they screen them and conduct active surveillance screening during camp activities. Thank you.
All right. Thank you so much, Dr. Kromade. But just before we let you go, maybe in 15 seconds, some students have asked a few questions. And one is, are gloves needed, allowed in camps, as important as masks or hand sanitizers?
The requirements are to come with face masks as much as possible and hand sanitizers. Gloves are not needed because in the process of wearing gloves, they can even transmit and continue to spread more infections after touching a lot of surfaces and touching people from hand to hand. So that can even leverage on infection transmission. So gloves are not part of the guidelines, and they've been. We had a webinar with them today where they've been told what are the requirements to come to camp with, which are strictly face masks and hand sanitizers, as well as the COVID-19 testing slip.
All right. We appreciate your time. Thank you so much, Deputy Director, Head of the One Health Division at the NCDC, Dr. Oyelade Kromade. Thank you so much for joining us at this time.
Thank you.
Still out on the program, South Africa approves vaccine for 12 to 17-year-olds. Please stay with us.